Hi, my name's Andrew Browning. I'm a fistula surgeon, but also the director and founder of a charity called Maternity Africa. So we treat a condition called obstetric fistula, which is a devastating injury in young women. Anywhere in the world, about 5% of women will get into obstructed labour, meaning the baby's getting stuck. And so ordinarily in England or Australia, or wherever you are, that's diagnosed very quickly by a midwife and you have a caesarean section. But in the majority of the world, in Africa especially, women just don't have access to get a caesarean section. So if they get into obstructed labour, then they stay in labour. And the ladies that I've treated have been in labour for 5, 6, 7, even up to about 10 days. If they survive, and many of them die because of the long labour, their baby inside dies and they deliver a dead baby. But because they've been in labour for so long, the baby's head's been pressing against the mother's pelvis and all that tissue in the pelvis dies and comes away and they're left with a fistula, or a hole between the bladder, birth canal, rectum and birth canal. So they're leaking urine and faeces continuously. They're very scared of this. The husbands divorce them, they get depressed, they're ashamed, and they live their life as outcasts for the rest of their life unless they can get treatment. So Maternity Africa provides treatment and trains surgeons all over Africa in doing this surgery. So here in Maternity Africa in Tanzania, we're trying to not only treat obstetric fistula, prevent it. The only way you can prevent a fistula is by ensuring ladies have access to safe obstetric care, to have a caesarean section if they need it. So there's many hospitals in Tanzania, but one of the lack of the problem in Tanzania is the midwives aren't trained. So we're building a hospital here, and when it's open, we can have access for say 2,500 to 3,000 women to deliver safely every year. And treat obstetric fistula, of course, but also train up to 60 midwives a year in clinical skills. And midwives in Tanzania are quite knowledgeable, but they lack clinical skills and clinical confidence. And that's what here at Maternity Africa we're going to fill the gap. This will be the hub where we can expand good obstetric care to make safe obstetrics accessible for women all around Tanzania. Working with partner hospitals, building perhaps other little mini units in remote places, and hopefully over time we'll be able to prevent obstetric fistula from occurring. So we've got a track record. We've built a couple of hospitals, maternity hospitals in Ethiopia, and we run those. And actually the regions that we've run and built them in, the government's actually proclaimed them to be the safest places to deliver women in the whole region of Ethiopia, which is wonderful. And likewise in Tanzania, we want this to be the centre of excellence in this region, to be the safest place where women can deliver. We'll train people and it will be the hub for good, safe obstetrics for this region of Tanzania. But we need help. We need partners to stand with us to deliver this work. We want to treat the poor women that will not have access ordinarily to good safe obstetrics. We want to train and support other units, but we need running costs. This building should be completed within the next month, but in March next year, 2018, we have to open this service, but we need funders, donors. So this will be the fistula ward, where we have 4 bays here. Each bay will have 4 beds. This is where all the fistula patients will come, be cared for, have their surgery in theatres over there and recuperate in here. So I'll take you through to theatre. So this will look very different in 6 months' time. So this is the nurses' station, very big, so we'll have our education for our pregnant ladies before they go home, or family planning, have some cots here for sick babies. This will be high risk obstetrics through here, so ladies that have blood pressure problems during their antenatal period or bleeding problems. This will be routine prenatal and antenatal, so before and after delivery in here. So it's another 20 beds in here. And then we come through here to the delivery room, labour room. It's all looking very dusty at the moment. We won't have this dust when it's open. Then if it's needed, then the women, if they need a caesarean, can just go straight through here into theatre. So this is our operating theatres where we'll deliver women by caesarean sections. Also look after early pregnancy complications like miscarriages and ectopic pregnancies. And of course also this will be where I'll be doing all my fistula surgery. So in here. So one of the things I'm really proud about and really interested in is we're trying to make this hospital as green or as environmentally sound as possible. So we're having solar. One generous donor has given us solar panels, and we're using biogas systems as well. So we're collecting all the waste material from the hospital and making gas out of it to power the kitchen and cook for everybody. So all we need every day is just 10%ers through the biogas system, and we can cook for the whole hospital. There's only 2 other hospitals in the world that do this, so we'll be the 3rd. And to give you an idea of the running costs, it's going to cost roughly around $200 for one woman to deliver safely at this hospital, and about $400 to treat a fistula patient at this hospital. So in broader picture, not a great deal of money, but it has enormous impact on these women's lives. Thank you for listening, and thank you for being willing to support. We really do need people to stand with us to make this building a living building, to offer care and compassion for women, and together with your help we can really impact the world, just one woman, one mother at a time.